Okay, good afternoon again. This is Olivia Giordano from the Healthy Start TA and Support Center. Thank you all for joining us for the final Healthy Start Data Collection Forms training session. This training will provide an overview of the parent-child form. We will go through some brief housekeeping, go over the agenda, and then we'll get into some opening remarks. Next slide, please. Okay, so again, we will go over brief housekeeping, then we'll hear a welcome from Ken Harris of the TA and Support Center. We'll then turn it over to Lee Wilson from the Bureau of Maternal and Child Health, who will provide a greeting. Then we'll hear from Robin Harwood, also from the Maternal and Child Health Bureau, and she will provide the overview of the parent-child form. We'll have some time for questions and answers, and then we'll hear a closing from Ken Harris. I'll turn it over to Tess Pritchard now for some housekeeping.
Welcome everyone. We'll begin this webinar by reviewing some housekeeping items. This session is being recorded and will be posted to the Epic Center for future viewing. All participants are muted upon entry. We ask that you please remain muted to limit background noise. We encourage you to use the chat box to ask questions or post comments throughout the webinar. All questions will be captured from the chat box and we will address as many as we can during the webinar. We will create a Q&A document that captures all questions and answers that will be available with the webinar recording. Moving into some audio logistics, if you can hear me now, you're likely connected correctly, but we'll do a quick review to make sure everyone's on the same page. Join the meeting by clicking the link in the email that was sent to you upon registering for this webinar. An audio conference box will appear. You can join by either computer audio or phone call. If you'd like to use computer audio, just click computer audio and you should be all set. If you would like to join by phone call, dial the given number, enter the meeting ID and press pound. Then enter your given participant ID and press pound. You will then be connected to the webinar audio. Next, we'll review the chat box. At the bottom of the Zoom screen, you will see a toolbar. Click chat and it will launch the chat box to the right side of your screen. Type your questions or comments into the chat box and send to everyone. Again, we encourage the use of the chat box for any questions or comments you may have during this webinar. Now that we've covered these housekeeping items, I'm going to hand it over to Ken Harris, Director of the Supporting Healthy Start Performance Project.
Thanks a lot, Tess and Olivia, and good afternoon to everyone, and good morning to some. It is great that we're here in the home stretch of these 3 trainings. And again, we thank you for your engagement throughout all of the trainings. Your feedback has been invaluable. Your contributing for questions has been great. So we here at the TA and Support Center look forward to continuing the engagement with you around these data collection forms. At this time, I would like to turn it over to Lee Wilson, who is the Acting Division Director, who wants to greet you this afternoon, and then I'll come back and get us started. Lee?
Good afternoon, folks. This is Lee Wilson. I wanted to take a couple minutes to thank you all for attending this session, and for those of you who have attended the first 2 training sessions. We're very happy to have you back. As Ken said, this is our 3rd training session and it's on the parent-child form. We have been really pleased with the turnout and attention given to these issues. If my memory serves, we had more than 900 participants on the call on Tuesday, and I think that's terrific. I think that speaks to the level of engagement and importance that you are giving to the data collection, tracking, and reporting activities around this program. We also know that this is a very busy time for you and it's a lot of information to take in. But as you know, we do need these data to tell the story of the program's success. We take it very seriously, and we use it to justify future funding for the Healthy Start program. You're going to see over the next 6 months to a year a real focus or emphasis on the attention that we're giving to the reporting and to the quality of that reporting, both in the resources that we're investing in this area, as well as the support that we're trying to provide to you and encouragement to be as timely and as accurate as possible. This is an area of particular scrutiny and focus for the agency and for the department. And I think as Vanessa and others have said over the last few days, we have a great story to tell, and I really want to be able to tell that to advance our mission and to help the clients that we serve. So in short, it's critical that we have high quality, accurate, and timely data. Our thought is that these 3 sessions will be the initiation of trainings to help you and get you started using the forms, which will go or be effective in working with clients, go into place on May 15th. But know that we plan to provide additional supports to you through TA training and other activities through NicheQ. So these 3 trainings are the first activities that will be followed up by others, including access and support for the CareWare system or for other tracking systems that you're using, database systems in-house, as well as support for the HSMED as it rolls into our EHB system. So following this session, a Q&A document is being developed, and it will be coming out after the training, which captures all of the questions that have been made. And I'm sorry, I keep looking down at my phone like I'm talking to the phone, which I guess I am. Capture all of the questions that we couldn't answer in the training or that we didn't get to. Some of the questions that you're asking are complex questions, and they relate to how the program is actually being delivered. And we would like to be able to standardize those questions and think thoroughly and seriously about the best way to answer them. So if we can't give you a direct answer right away, know that we are trying to be as clear and concise and deliver one message to you, even if that means you don't get it immediately. So we want you all to feel confident in using the forms and clear in their purpose. So please do let NicheQ and the division know how we can continue to support your learning through your questions and answers and through any other additional guidance or information that you need, whether it's more trainings, whether it's more videos, whether you need something in writing that can clarify for you, we're happy to do that. We'd also like to say, and this is my general approach, is that there is no wrong door. And if you just remember that term, there's no wrong door for asking questions of us, whether those questions go to NicheQ, whether those questions go to your project officer, or whether they come into the mailbox that we have set up on the internet for you. Our preference is that questions in a general nature, unless they're specific to a training that you may have received, that questions would come into the inbox so that we can track them, we can see how many questions we're getting on a particular topic. And if we need to retool our messaging or our documents, or if we've done something wrong and we need to correct that, that helps us with the tracking and the modifications. Again, we appreciate you making room for these important trainings in your schedule and your attention. I may not be able to stay on for the whole training, but I will be here for the first half hour, and be jumping on, off and on. But before I sign off here, I want to take a moment to first thank Robin Harwood for her hard work on the forms, the design of these trainings, and for her presentations on each of the training sessions. This has been a project spanning years for Robin when it came to the design of the questions and revamping of the questions, submitting those materials to OMB, responding to their questions in public comment, and ultimately taking that information and translating that into a training. So the work is good. It's nice to be able to see a product to its end, and we would like to thank you, Robin. I'd also like to thank the NicheQ team, Ken, Olivia, and Tess in particular, and the others at NicheQ who've been working on this for their outstanding work to make these trainings a reality. We couldn't have put these trainings on without your support and assistance, especially creating the demo videos, so thank you. And speaking of the demo videos, I'd like to give a big thank you to the Boston Healthy Start Initiative for agreeing to be stars of the video, for doing your acting so well, and for doing this under short notice and under such sort of unique circumstances, given, not sort of, but actually unique circumstances given the situation that we're all facing. Your time and your partnership are really appreciated. That's all I have to say. Thank you very much again for your time. I hope this is a productive couple hours for you, and please feel free to reach out to us, to your project officers, and to NicheQ if you have any concerns or questions in the future. Thank you and have a great day. Bye-bye.
Thank you so much, Lee. And again, thanks to Boston Healthy Start, again, I agree. It was great that they showed up, especially during this time, and we reached out to them under these times of uncertainty, and they jumped right in. So thank you again. Next slide. So just to get us started, I just wanted to remind us of the survey. You can go to the next slide. So we have 2 surveys. Thank you for those that have already completed the surveys for the first 2 trainings. And here are the links for those. And if you haven't had a chance to complete the survey, please still go ahead and do that. The links are here for your convenience. Your thoughts about these trainings are of high value in our process for improvement. So please complete the surveys, and there will also be one at the end of today. But just make sure that you do all 3 surveys. It'd be really, really helpful for us. So thank you again for those that have already completed them. Next slide. Again, this is our 3rd and final training of the 3, just for the introduction. So again, we're happy to facilitate today's training on behalf of the division, partnership with the division. And today's training is, as you heard, will focus on the parent and child form. And again, Robin is here to help us round it out. And again, another shout out to her for all of her work, working with the center and getting the training together and helping us set a great foundation for the ongoing support that we will be providing to all the Healthy Start grantees. And so we're looking forward to her facilitating today. Next slide, please. With regards, again, you've continually heard about the follow-up document Lee articulated. So we're continuing working on that, and questions from today will also be added to that document. And so after today's training, we'll continue to work with the division to get your questions answered. And again, thank you for submitting your questions beforehand. And as we've said before, we've attempted to incorporate as many of those answers into the design of these trainings. And so hopefully many of those questions will get answered throughout the training today. And we will also have some time today, as we did last training, to address some questions after you've had a chance to practice with the form. So we look forward to that today. Next slide, please. Some answers that we wanted to highlight, again, just to remind folks, and you heard Lee mention May 15th. Again, that is the date that you're going to start using the forms, the data collection forms. Also, the forms as well as the crosswalk are already available on the website, so please check it out if you need to get those forms or look at the crosswalk. Again, we've mentioned before, the tools will be translated to Spanish. That's in process, and so again, that's forthcoming. And then all of the past trainings as well as the demo videos are available for you. So here are the links here, but again, if you need to check them out, go right to the website. So next slide, please. So reviewing the timeline, the important date here, again, was that May 15th date. And then also, as you've heard throughout the trainings that we're developing, the CareWare database, again, it's not mandatory that you use this data system, but we're hoping that folks will see the benefit of using it and certainly get ready for that training on that database that's coming. So you'll see that'll be happening in June. We hope to give a demo of the data system at our grantees meeting, and then provide some training and get ready to start entering that data in August. So keep those dates in mind as we continue to move forward with our training and support around these forms in the database. Next slide, please. So for today, we reviewed a little bit from last session. We've gone over the timeline just now. Again, Robin is going to introduce the parent-child form today. We'll take a look at the demo. And again, the Boston Healthy Start initiative has supported us in completing. We're going to have time for practice today. And as with last time, we'll get into some Q&A at the close. Next slide. So I just encourage you, invite you, if you have or don't have the parent-child form, you might want to grab it and have that available to you throughout today's training as Robin is going along. And then also you'll need it for later on when we do some practice. So with that, we're excited to, again, facilitate the last of the 3 trainings, and I turn it over to you, Robin. Thank you.
Thanks, Ken. Good afternoon and good morning to everybody. I've really enjoyed the opportunity to be a part of these trainings, and I'd like to welcome you all to this 3rd training session. This is the parent-child form, as Ken indicated, and this is to be completed by the primary custodial guardian of children 0 to 18 months who are enrolled in Healthy Start. Next slide, please. First, we'll go over a few general instructions and then describe the general structure of the questionnaire itself. Next slide, please. First, as we've mentioned before, there's one parent-child form per child, so each child should have their own parent-child form completed by the primary custodial parent. In most cases, this would also be the primary participant. However, in the first session, if you'll remember, we discussed cases where the child's custodial guardian is perhaps a grandmother who falls outside the age criteria of 15 to 44 years. And so in that case, the grandmother would complete it, even though she's considered an accompanying adult. Next slide, please. In terms of the unique ID, the parent-child form is the place where you'll put the child's unique ID. And we also have here places for you to put the unique IDs of the primary participant and any accompanying adult. And we have them together here so that each child's unique ID can be linked accurately to the primary participant and any accompanying adult. And you'll notice that the enrolled child's unique ID has the letters EC in the middle to indicate enrolled child. And it follows the same pattern as those of the primary participant and accompanying adult that we talked about yesterday with the previous training, with the 3-digit ORD code followed by the letters EC for enrolled child and then the child's ID number. Next slide, please. And here's the structure of the parent-child form. As you can see, it's longer than the prenatal form, but shorter than the background information form. So the background information form provides information on the adult or adults connected to that child, and the parent-child form provides information on the child, including the pregnancy that provided that child's in utero developmental context. Next slide, please. Okay, now I'll turn it over to Ken, Olivia, and Tess for the demonstration.
Welcome to the third and final Healthy Start data collection form demonstration video. In this video, we will demonstrate how to administer the Healthy Start parent-child form. Morgan, a Healthy Start family coordinator, will administer the form to Maria, a Healthy Start mom. Maria has a 14-month-old daughter and is currently 4 months pregnant with her second child. Maria's boyfriend, Nick, often accompanies Maria to her prenatal visits and Healthy Start classes. Let's get started. The first step is to complete the grantee records section. This box contains information that is important for your Healthy Start site's records. Before beginning the interview, Morgan will fill in this box with the primary participant's name and date of birth. In this case, the primary participant is Maria. Morgan will also fill in the enrolled child's name and date of birth. In this case, the enrolled child is Maria's 14-month-old daughter, Nina. Finally, Morgan will fill in the accompanying adult's name and date of birth. In this case, the accompanying adult is Maria's boyfriend, Nick. Morgan will also fill in the interviewer's name. In this case, the interviewer is Morgan herself. Morgan will read the entire section, including the public burden statement, before moving on. This next section contains important information about who should complete the parent-child form. Remember, the parent-child form should be completed with primary participants who have a live child younger than 18 months who they wish to enroll in Healthy Start. Primary participants who do not have a live child younger than 18 months should not complete this form. Accompanying adults should also not complete this form. If the primary participant has more than one child younger than 18 months, one parent-child form should be completed for each child. Before completing the parent-child form, the mother or other custodial parent should also have completed a new or updated background information form. There are 2 questions at the end of the parent-child form for mothers only. These questions ask about the mother's pregnancy with the enrolled child. Enrolled fathers or other custodial parents should not answer these questions. You will need to provide a unique ID number for both the primary participant, the accompanying adult, and the enrolled child. This form should be updated when the infant turns 6 months of age if the primary participant or custodial parent changes and/or when the child exits the Healthy Start program. This section asks for identifying information about the primary participant, the enrolled child, and the accompanying adult. Morgan will read and fill out the entire general information section before beginning the interview with Maria. Morgan is now ready to begin conducting the interview with Maria. Remember, the forms must be administered by a trained Healthy Start staff member. It should not be self-administered or administered by untrained staff. It is important that you read all of the text in italics as it is written. This helps ensure that all Healthy Start sites ask the questions in a uniform manner. You will notice instructions or notes for staff throughout the form. These notes typically say staff and are bracketed. This text should not be read out loud to the participant, but instead is meant to notify you of ways you should ask the question or things you should consider when asking the question. If the custodial or accompanying adult changes, you will need to complete a new background information form with a new unique ID for that new person. This will allow your program to record changes across the enrolled child's time in Healthy Start. If an enrolled woman completing this form is pregnant, she should also complete the prenatal form.
Thank you for participating in the Healthy Start program. The purpose of these forms is to examine how well the Healthy Start program is meeting its goals of helping families improve their health and the health of their babies. This questionnaire should take about 25 minutes to complete. Any information you provide will be kept confidential. You do not have to answer any questions you do not want to, and you can end the interview at any time without any penalty or loss of benefits. In this questionnaire, we will ask you questions about your enrolled child. Enrolled women will also respond to a few questions at the end about their health around the time of the child's birth.
In this first section, you will notice a staff note. This staff note indicates that you should read some additional text if the participant has more than one enrolled child under 18 months of age. The additional text reads, "We will complete a separate form for each of your babies or children. Since you have more than one child who is less than 18 months enrolled in Healthy Start, we ask you to focus only on one child at a time. We will then complete a separate questionnaire for each of your babies under 18 months old." As the staff note indicates, this additional text should only be read aloud to the participant if they have more than one enrolled child under 18 months of age. The next couple of questions ask the participant to select one answer out of a list of possible answers. Be sure to read all of the answers to the participant before they select their final answer.
This section focuses on this child and his or her health. First, I'd like to start with some general background questions about your child. Was your child receiving health services before birth, i.e. born into the program, part of a family enrolled for services within 30 days following child's birth, part of a family enrolled for services more than 30 days following child's birth?
Since this is my first time in Healthy Start, it will be part of a family enrolled more than 30 days. And I guess it will be 14 months old at the time of enrollment, right?
Yes.
The third answer under question 1 reads, "Part of a family enrolled for services more than 30 days following the child's birth." If the participant selects this answer, They will also need to indicate their child's age at the time of enrollment. Be on the lookout for these additional questions, which may need to be asked depending on the participant's answer to the first question.
Is this child of Hispanic or Latino or Latina origin?
No.
The next two questions ask about race and racial classification. For question 3, what is the child's race? The participant can select all answers that apply. For question 4, the participant should only select the one answer that best describes the child's racial background.
What is this child's race? Select all that apply: American Indian or Alaska Native, Asian, Black or African American, Native Hawaiian, or other Pacific Islander, white, don't know, decline to answer.
Black African American.
Which one racial classification below do you think best describes your child's racial background? Select one only: American Indian or Alaska Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, white, more than one race, biracial, multiracial, other, don't know, decline to answer.
Black African American.
You will notice several staff notes in this next section. Remember, the notes should not be read aloud to the participant. Instead, the interviewer should read the notes to him or herself and help use them to guide or inform how to ask the questions. Again, you might find it helpful to highlight these staff notes and familiarize yourself with them before administering the forms. For example, the staff note in question 5 reads, "Please enter the number of weeks. If the participant does not know the number of weeks, help them calculate backwards from the baby's original due date to determine weeks of gestation at birth." This note lets you know that you should pause and help the woman determine how many weeks pregnant she was when she gave birth to this child.
Next, we're going to ask you some questions about this child's health when he or she was born. How many weeks pregnant were you when he or she was born?
35 weeks.
The staff note in question 6 reads, "Was the child preterm or earlier than 37 weeks of pregnancy?" If the woman replied to question 5 that she gave birth before she was 37 weeks pregnant, you should mark yes for question 6. If the woman replied to question 5 that she gave birth after she was 37 weeks pregnant, you should mark no for question 6.
How much did he or she weigh at birth?
She was 6 pounds, 2 ounces.
Okay.
The staff note in question 8 reads, "Please check the appropriate box below for the baby's birth weight." Your answer to this question will depend on the participant's answer to question 7. For example, if the participant indicated that the child weighed less than 3 pounds 5 ounces at birth, then you would check very low birth weight for question 8.
Was the child the only baby you were pregnant with at the time, or was it a multiple birth, such as twins, triplets, or more?
It was one baby.
These next few questions are about your child's health care. Is there a place you or another caregiver usually take this child when he or she is sick or you need advice about his or her health? Where does this child usually go first? The doctor's office, hospital emergency room, hospital outpatient department, clinic or health center, retail store clinic or minute clinic, school, nurse's office, athletic trainer's office, some other place, don't know, decline to answer.
I usually take my baby to the doctor's office.
The staff note in question 11 reads, "If the participant says urgent care, mark this as some other place and write in urgent care." If the participant does not know what a minute clinic is, Explain that it is a walk-in clinic at a local pharmacy or store.
During the past 12 months, was this child ever covered by any kind of health insurance or health coverage plan? Yes, this child was covered all 12 months. Yes, but this child had a gap in coverage. No, don't know, decline to answer.
Yes, covered all 12 months.
What kinds of health insurance is your child covered by now? Please select all that apply. Private health insurance from my job or the job of my husband or partner. Private health insurance from my parents. Private health insurance from the state health insurance marketplace. Medicaid, CHIP, subsidized ACA plan, also called subsidized premium or subsidized coverage through the Affordable Care Act, TRICARE or other military health care, Indian Health Service, or tribal other health insurance. I do not have health insurance for this child now. Don't know, decline to answer.
Private health insurance from my partner's job.
Question 13 is another example of a question that may require you to write in additional information, depending on the participant's answer. For example, if the participant indicates that the child is covered by Medicaid, write in the name of the state Medicaid they are covered by. If the participant indicates that the child is covered by Indian Health Services or tribal, select No Health Insurance. If the participant indicates that the child is covered by another health insurance, write in the type of insurance.
How old was this child at his or her last well-child checkup?
12 months old.
The staff note in question 14 provides the American Academy of Pediatrics recommended schedule for well-child visits for the first 18 months of life. The staff note in question 14A states, compare the child's current age with their age at their most recent well visit and determine, was this child's last well child visit within the time frame recommended for this child's age? For example, a 10-month-old baby has had her 9-month visit. Reference the well visit schedule provided under question 14 to determine if the child's last well child visit was within the recommended time frame for their age.
The next few questions are about breastfeeding. Did you or the biological mother ever breastfeed or pump breast milk to feed this child after delivery, even for a short period of time?
Yes.
Is this child currently being breastfed or fed pumped milk?
Yes.
How many months up till current date was this child breastfed or fed pumped milk? Not at all. Less than 1 month, still breastfeeding.
I'm still breastfeeding, so 14 months.
Question 17 asks, how many months up until the current date was this child breastfed or fed pumped milk? Please note, if the mother is still breastfeeding or feeding her child pumped milk, you should indicate how many months the child has been breastfed or fed pumped milk so far. Question 18 asks, was this child breastfed or fed pumped milk for the first 6 months of life? Please note, if the mother is currently breastfeeding or feeding the child pumped milk, you should also revisit questions 17 and 18 once she has stopped. This will allow you to capture the total amount of time the child was breastfed or fed pumped milk. This section includes questions about infant sleep. If the child is 12 months of age or older, these questions are not applicable to them. Check Not Applicable in each box and move on to the next section. If the child is younger than 12 months of age, you should proceed with asking the questions in this section.
Next, we have a couple of questions about your child's home life. These are the last questions that focus on the child. After that, we will ask enrolled women a few additional questions about the pregnancy.
Question 21 asks how often the participant reads or looks at books with their child. Please note, reading includes books with words or pictures and/or textures for the baby to see and feel, but not books read by an audio tape, record, CD, or computer.
During the past week, how many days did you or other family members read or look at books with your child? Did not read to the baby in the past week, 1 to 2 days in the past week, 3 days in the past week, 4 to 7 days in the past week. Don't know, decline to answer.
I would say like 3 days in the past week.
Next, we have a question about home relationships that the baby or child experiences. Would you describe this child's second primary parent as involved and supportive of me and the child, involved with child but not supportive of me, involved and supportive of me but not the child, not regularly involved, supportive in either mine or the child's life? There is no second parent. Don't know, decline to answer.
Involved and supportive of me and the child.
This concludes the series of questions about the enrolled child. Next, we will move on to the questions about the mother's pregnancy. Remember, enrolled fathers or other custodial parents should not answer these questions. These questions are for the mother only.
In this final section, I'd like to ask a couple of questions about your pregnancy with this child. The next question is about the postpartum care you may have received following your most recent delivery. Recently, doctors have been talking about what they now call the fourth trimester, and this includes ongoing contact with an obstetric care provider, i.e. OBGYN, nurse, midwife, during the 12 weeks following labor and delivery. Postpartum care is important to ensure your ongoing health. Did you receive postpartum care from an obstetric care provider following your most recent delivery? Select all that apply. Yes, within the first 3 weeks following delivery. Yes, between 4 weeks and 6 weeks following delivery. Yes, between 7 weeks and 8 weeks following delivery. Yes, between 9 and 12 weeks following delivery. Not yet, but one is already scheduled for the following date. Not yet, but let's work on making an appointment. No, I did not have a postpartum visit with an obstetric care provider within 12 weeks of the birth of my most recent child. Don't know, decline to answer.
Yes, between 7 and 8 weeks.
Question 23 asks whether the woman received postpartum care following her most recent delivery. Please note, if the woman indicates that she received postpartum care after 12 weeks of delivering, explain that this is not considered a postpartum checkup. The checkup must occur within 12 weeks of delivering to be considered a postpartum checkup. If the woman is within 12 weeks of delivering and has not yet had a postpartum visit, mark this question and revisit it. This question should be updated accordingly after the woman has passed 12 weeks postpartum.
These next two questions ask about tobacco and nicotine use during the last 3 months of your pregnancy with this child. In the last 3 months of your pregnancy with this child, how many cigarettes did you smoke on an average day? A pack has 20 cigarettes.
I didn't smoke then.
Questions 24 and 25 screen for tobacco or nicotine product use. For question 25, make sure you read through each nicotine product type and the possible answers for each. For example, more than once a day, 2 to 6 days a week, 1 day a week or less, not at all, don't know, or decline to answer. You should enter one answer for each nicotine product type.
During the last 3 months of your pregnancy with this child, on average, how often did you use other tobacco or nicotine products? e-cigarettes or other electronic nicotine products more than once a day, 2 to 6 days a week, 1 day a week or less, not at all, don't know, decline to answer.
Not at all.
Hookah,
Not at all.
chewing tobacco, snuff, snus, or dip,
Not at all.
cigars, cigarrillos, or little filter cigars.
Not at all.
Once these questions have been answered, the parent-child form is considered complete. Thank you for taking the time to watch this demonstration of the Healthy Start parent-child form. We hope this guidance helps you successfully administer the form to Healthy Start participants. If you have any questions or comments, please email healthystart@nichq.org. That's healthystart@nichq.org.
Yeah, all right. Well, thank you. We're going to take some time to practice, and so I'm going to turn it over to Olivia, and you want to share with them the instructions for what we're going to do for practice time, and then we'll be coming back.
Sure, thank you.
Mm-hmm.
All right, so we'll take about 15 minutes to practice. So let's reconvene at 1:35 Eastern Standard Time. So that's 12:35 Central Time and 10:35 Pacific Time. So you can work with a partner if you'd like to call someone from your team or Zoom with them or something. Feel free to do that. If not, you can just work independently to review the form and practice using it.
So great. Thank you, Tess and Olivia, and I hope everyone had a good experience with handling the forms, whether you had a partner to do that or to go through it yourself. We've all have kept our eyes on the chat box, and so just before we get into some frequently asked questions, Robin and I will do what we did in the last training, just to go through some of these more popular frequently asked questions. But just before we get into that, just wanted to acknowledge some chat that was going on in the chat box, and really initiated, I think, by Nancy Torres and Natasha Ray, which really was about engaging. And they're engaged in some great dialogue about how the questions are actually asked, and it warrants us, taking time to do a study session on really looking at the art of how to ask questions to get the information you need in a client-centered way that's engaging and really builds that trust. And so the TA and Support Center can provide a webinar to explore that topic a bit more and give us an opportunity, and you all as grantees, to talk more about asking these questions and how to ask them so that you can really foster that building trust in that engagement. So it warranted mentioning, so we wanted to lift that up, as well as a lot of other comments and suggestions that we'll be able to look at and in our Q&A document, kind of highlight and lift up some of those things that can go into subsequent webinar offerings from the TA Center. So thank you all for engaging in the chat, and so continue to do that as we round up the rest of today. So Robin, we want to go ahead and check out some of these frequently asked questions. Again, one was how often and in what time frame should the parent-child form be completed? And there were some questions even in the chat box around that, but what is the answer to this particular question?
Well, it should be completed as soon as a child is enrolled. And then assuming they're enrolled before the age of 6 months, then they would be completed again or updated at 6 months.
Mm-hmm.
The transition between postpartum and interconception phases.
Okay.
It may also need to be completed if there's a change in custody, because you have a different parent who may not be following the same safe sleep practices and so on. And so you kind of need to know how the child's context is changing.
Mm-hmm.
And then, if possible, to complete it when the child exits the program.
Mm-hmm. Okay, so really clear, completed, enrolling that newly born child, infant, and then also infant turned 6 months, and then again, the other time would be, as Robin said, updated when there's a change in custodial parents. Okay, thank you, Robin. Let's go to the next slide. Okay, so when we update the form at 6 months, do we ask all of the questions? If so, should we erase and overwrite the answers from the past form? So what's our answer there, Rosa?
Yeah, and that's the same as what we discussed with the background information form and the prenatal form, that when you update, you're not going to overwrite or erase any of the original data. We want to be able to track over time, so we're going to keep the original data, and you essentially go through it with them again to find out if certain things are still true or whether they've changed.
Mm-hmm.
So you basically do re-administer it, but speaking of the art of interviewing, I think this would be a great example of that.
Mm-hmm. Okay. All right. Thanks. All right. Next slide. So another frequently asked question about the parent-child form was for question 12. Can we choose yes, this child was covered all 12 months if the child is under 12 months and had uninterrupted health insurance?
Yes, I would say yes, do that for now, and program may also wish to consider whether, what to do with that in the future, whether to another response option available in the future.
Okay, so yes for now. For babies
Yeah.
less than a year, open covered. Okay. All right, thank you. Let's go to the next slide. Another frequently asked question about the parent-child form was in regards to question 14. So how do we determine if a child was in the recommended time frame for a well-child visit?
Yeah, I think that Morgan in the video did a great job with that. The child was 14 months old. The recommendations are 12 months and 15 months. The child had a 12-month visit and is not yet old enough for the 15-month. So yes, they've had the recommended one for their age.
Yeah, according to American Academy of Pediatrics. Great, thank you. Next slide, please. So another frequently asked question about the parent-child form was, what is the definition for exit? Is this only program completion, like baby turned 18 months, or early exit from the program? Oftentimes this occurs because the participant is lost to follow up.
Yeah. We understand that that does happen. There is attrition. We definitely want the form completed if the baby leaves early and if there's an opportunity to do that. Because we want to make sure we see the progress over time. But we also, like I said, understand that sometimes people leave abruptly and there's no opportunity to do that.
Okay, all right. So again, these were, we picked out FAQs that came up repeatedly and wanted to start with those. With the time that we have left, we want to now, next slide, open up for questions that are in the chat box. So again, if you have questions, chat them in, and we'll again assure that all questions will make it to that document that we're preparing for you with the division. So we'll get to as many as we can today, but know that the questions will be gathered and considered and answered. So Olivia, I'll look to you to lift up questions for Robin and myself.
Sure, thank you. One question we received was, at the start of the parent-child form, there's a question where we indicate primary participant type, and other adult with primary custody of child is an option. Does this mean that a grandmother with an enrolled child would actually be a primary participant? The instructions on the form specifically say that accompanying adults do not complete the parent-child form.
Yeah, I think it refers to a legal guardian situation where a woman who's within the age range of 15 to 44 years would be acting as the legal guardian. But this is something that program needs to, address more fully. If you have a grandmother who's within the age range, does she count at that point, or does she stay an accompanying adult? I mean, we need to discuss this internally first, and then, share with you all what the answer is.
Okay, thank you. Could you describe the distinction between question 3 and 4? So what is this child's race is question 3, and question 4 is, which one racial classification below do you think best describes your child's racial background?
Yeah, we spent a lot of time talking about this in the initial training session, if you had the opportunity to attend that. And basically, it goes back to the differing purposes that questions have. And, you know, there are a lot of people who would like to be able to amend the race question, but the guidelines that were given, we have to ask the standard race question in order to be comparable to other national standardized interviews and survey data. So we can't change that, but at the same time, this is a relationship with a client, and you know, the trust is very important. And so we want to be able to accommodate in some way. You know, and a lot of people, they may be, you know, multiracial and they may check off boxes, but they may say, you know, but I consider myself to be Latina or you know, something else. And so, or I just consider myself to be multiracial. And so we want to be able to capture with one answer what the mother considers herself. And this is also very, very useful for data analyses and data reporting, to have just one racial variable associated with each woman. But we still have the data that's standardized and can be compared to, you know, the national data.
Thank you. For question 12, which asks about the type of health insurance the child has, what would you mark if the child is not eligible for health insurance?
Yeah, I would suggest marking that they don't have it. Whether or not there should be a decision to indicate eligibility, that's something program, you know, will need to discuss and consider and make a determination about. Because, you know, it's complicated indicating if a mother is not eligible. I don't know.
Okay. For question 18, which asks, was this child breastfed or fed pumped milk for the first 6 months of life? Is this exclusively breastfeeding or just fed breast milk at any point?
That's something that program will need to decide as to how they define breastfeeding.
Okay.
Okay, so we'll look forward to a more complete answer on that in the document. Thank you.
When you go back to update the time when the woman stopped breastfeeding, do you need to update the entire form or just that one section?
Just that one section in order to indicate when she stopped breastfeeding.
Okay. In the case of twins, do we complete the mother section on both forms?
Yeah, because it's information that's actually linked in the database to the individual child. It's not linked to the mother per se. I mean, it's there in the database as, you know, under her, but it's still linked specifically to the child. And it's only 3 questions, so it should be fairly easy to just say, oh yes, and I assume that's the same for this other child, or, you know, is that the same for the other child? And they say yes. And I mean, it's only 3 questions, so hopefully it will be fine that way.
Okay. To clarify, the accompanying adult would never complete this form.
Well, we need this form for every child. And if there is no primary participant, because the person responsible for the child is a grandmother who's outside of the age range for serving women through Healthy Start, then it has to be the accompanying adult. I mean, this isn't something that we would, you know, encourage people to do. Oh yes, accompanying adults should go ahead and complete this form. That's not what we're saying, but every child does have to have one. And so if there is no primary participant, then that only leaves the person who is the accompanying adult to do it.
Okay. And I believe we went over this, but just to clarify, if there's more than one child under 18 months, the form, you would fill out 2 forms, correct?
Yes, each child would have his or her own form.
Okay. Do these forms, so all of the new forms, need to be completed for clients enrolled in 2019 or just those enrolled in 2020?
If any client comes in, you would administer it. So if any of the 2019 clients come in for a visit, then you would go ahead and administer it at that time. If they don't come in, then you would not go back and administer it.
Okay. Let's see. There were a few questions again about the unique ID. So Tess, would we be able to just quickly go back to that unique ID slide?
Yeah, and thank you for bringing that one up, Olivia, because I saw a few of those as well and thought it'd be good to go back over this as we did the last training.
So Robin, could you just describe again how the unique ID is generated?
Sure. The first three letters are your site's org code, and we can send you that. If you contact NicheQ, they can make sure you get a copy of it, or apparently your project officer may have it. But it's a 3-digit number, and it indicates where the person is located. And we needed this because in the prior round of data collection, some sites would randomly generate identical numbers for clients. And so without the information about where the client was, we sometimes had a lot of difficulty tracing which number it needed to be merged with which other number. We couldn't differentiate when it came to merging data sets as to which client was which client if they had the same randomly generated number across sites. So this is to make sure we know, even if you have a randomly generated number or a sequentially ordered number, that's the same as another site, it's okay. All you need to worry about is your own site because you have that beginning code right there. And then next, to make it easier just to generate the numbers and to keep things organized, there's a 2-letter code, PP for primary participant, AA for accompanying adult, EC for enrolled child. And again, this is just to make the process easier and facilitate data combining, data merging, data analyses, and so on. And also you can look at it and say, oh, this ID belongs to a child, and that could be helpful at some point to be able to do that if you're looking something up and you have a whole long list of numbers and you're like, well, it's only these ones that could apply. So then the last number is the client number. And there have been a lot of questions about this. And, I think program is going to have to get together and talk about what's best because it involves, HSMED, Careware, everything. And so they're going to have to really talk about this to figure out what the best answer is. It's not easier actually to have separate fields because it's very, very difficult to combine it again in a statistical software database. If you have, one column that is just the org code and another column that is the unique ID, it's very difficult to find a way to systematically recombine those.
Okay, thank you.
And Olivia, just before you move on, I would just emphasize again to folks, if you don't know your code, just reach out to us and we'll have that code that we'll be able to give you for your organizational code because there are a lot of comments about that. Okay. All right, got one more, Olivia?
I just wanted to say that we would hope that the software program would be able to generate the unique ID that would help you have multiple caseworkers at a time working with mothers and they're all trying to assign numbers, and then the program is just automatically doing it. But again, that's something that has to be worked out with the actual software and HSMED. And so again, that's going to be left to program to discuss.
And just for grantees on the call that are here, that's a note that we took at the center, something we need to make to inquire and build in, and that's automatic generation of these to help you. So, so the comments and suggestions are great, and we're taking them in, and our goal is to really make sure we build it so it's really easy and makes sense for you all. So that's a good point to bring up, and we certainly will be looking at to do that. Just so
Yeah, and just here, there's a question about so you're saying if my 9th mom has an accompanying adult, and so mom is XXXPP009, what is dad?
Mm-hmm. Yeah, it's great. Yeah, it's a great
Yeah.
question. Which is why we're spending time thinking it
let
through.
program discuss that, right?
Yeah, we definitely have to think it through because that's a very good example.
It is a very good example, yes.
So thank you to the person that put that out there.
Yeah.
All right. So again, it's a 1:54 now. We're about to wrap up today's training, but again, just to emphasize that all the questions and suggestions that you've put in the chat box, we will be taking and integrating into this Q&A document that we've continued to refer to throughout these trainings. Again, thank you again for being engaged and involved and submitting these questions. And we also appreciate the conversations that you all have had with each other as well, supporting each other with your thoughts about different things, and that has come through as well. So we'll do our best to attempt to bring some of that out as well. As we have subsequent sessions, you'll have a chance to talk among each other on some of your thoughts and ideas as we walk through each of the forms. And so just wanted to thank you again for that. You can go to the next slide for me. And so again, we thank you for attending all of the trainings. And note, if any of your staff is administering the tools, they should first complete the training. So if there are new folks coming on, just make sure you go ahead and access the trainings through the website to make sure they have the training before administering the forms. That's really important. Next slide. Again, as we continue to support you as we move forward in using the form, all the presentation training are available, as I said. The division and the TA Center will send out that document to grantees by, goes by May 14th, so that you'll have this document with questions and answers. And then also, we will be setting up what we're gonna call office hours to just have more time with the form. So as you're continue to review them and you start using them, we will certainly be setting up office hours to really have an opportunity to go through some of the experiences that you're having and hear more about your what's happening as you're implementing this form. So you can expect to have office hours on these and support around the data collection forms. Next slide. So again, I said in the beginning how important it was for the surveys. And so if you didn't do the survey from the first couple of sessions, please do that. And today we also right now ask you to take about 5 minutes to go ahead and complete today's survey. Again, your comments and experience are really valuable to us as we think about future trainings. And so please take time to complete a short survey, and it really takes just 5 minutes. So go ahead and take that website down and do the survey. Next slide. So with that, I want to thank you again. And again, if there are any questions at the conclusion of these 3 trainings, any questions moving forward, we want you to send those questions to mchbhealthystart@hrsa.gov. So we want you to send all questions there. And when you send your questions, please indicate what it pertains to as a subject header, whether it's around careware, if it's around HSMED2, or the data collection forms. This just helps us to categorize your questions and get them answered as quickly as we can. So we will continue to work with the division and getting answers to those questions and getting them back to you. But again, any questions you have from this point on, we're gonna ask that they be centralized and sent to mchbhealthystart@hrsa.gov. And again, it'll be helpful to have that subject header there for us to help fill those questions. So we thank you again for hanging out with us for 3 sessions. We know, again, these are challenging times for everyone, and your time is quite valuable. And we know that we needed to get this training in. So we appreciate everyone that helped us pull it together. Again, thanking Boston Healthy Start. And I thank my staff and colleagues here at NICHQ and also the division and everyone that worked hard to put these trainings together. So again, if you have any questions, just let us know through that website. But we hope that you have a great rest of the week, and we look forward to working with you and supporting you around these data collection forms. So thank you and have a great afternoon.